Yeah, and thank you, Doc, for the invitation, because I believe that from an economics point of view, something that I always took into account in areas of economic studies and health economics um, was at the forefront of development and the objective of development in improving the quality of life of people. And the subject of or the theme of the workshop, Transforming Primary Health Care in Fiji, I think is a timely one. It's a significant one, and one that is going to define how we as a country are able to deal with not only our health issues, but also how we can grow our country. And I want to particularly acknowledge the Ministry of Health and the World Health Organization for putting this program. I was looking at the workshop document this morning. I came in the office at 6:30, and I had two other meetings before this one. And I was quite excited at the topics that you have and that you will be discussing. This three-day workshop, I know, includes some very good experts, leaders in the health sector, frontline practitioners, stakeholder agencies, and people from the social sectors. We all agree that we've gone through a very difficult period during COVID, and indeed post-COVID. And COVID pandemic has really changed the whole architecture of politics, economics. There are new imperatives in geopolitics, geoeconomics, and how countries put themselves at the development agenda. The transformation of the health sector is very important. When I was in opposition for 8 years, and Dr. Fong knows this, sometimes he may not have been very happy with what I used to say. But truly, we had one of the worst health services ever in the history of this country over the last several years. From deterioration in our infrastructure, in terms of service delivery, and in terms of putting everything together in the context of development that supports how we as a country are able to perform and progress. And I'm very pleased to say that we now have a very competent Minister for Health who in opposition, sometimes, it's better to come into government having been in opposition because you are able to see from a perspective that usually you don't when you are in government. And the agenda for the new coalition government is very clear. We have laid ourselves a objective that in the next 4 years we are going to transform our health sector, right from primary care to tertiary care. Primary health care, from an economist point of view, is absolutely important, and it does impinge on a number of areas. First of all, a much more integrated, efficient and effective primary health care is going to generally reduce the health costs in the country. When you reduce the health costs, when you pay attention to primary health care, you also increase productivity. And any country, any finance, looking at how to grow the economy will obviously look at the state of our health services. And increased productivity is a direct result of good, effective primary health care.